Good day, Virgin Islanders. I hope that you are doing well as we approach this holy time in our season. I'm joined today by the Commissioner of Education, Racquel Benjamin, the Commissioner of Human Services, Kimberley Causey-Gomez, and of course, our very own Health Commissioner, Justa Encarnacion, is here to answer any questions you may have of a medical nature. Today, we have tested 322 individuals for COVID-19 in the territory. 242 of those tests came back negative, 45 positive, and we have 35 tests pending. 39 of the 45 that we have tested positive has recovered, which means we are currently tracking 5 individuals in the territory with COVID-19. Of course, you know we had the one patient that passed away. We currently have 1 positive COVID patient hospitalized at the Juan F. Louis Hospital, and we are happy to report that 2 of the 3 COVID patients hospitalized at the Roy Lester Schneider Regional Center are recovering and will be discharged today. I encourage all of you to check with the Health Department's website, where it is broken down by island and every single demographic you can think about. That website is doh.vi.gov, and the report is updated every single day in the evening to keep you abreast of what is going on. There's been a lot of discussion about the vessels in our harbors, and early in our response to this pandemic, we have created a marine task force to go about tracking this activity in our waters, because we wanted to be sure that we were keeping track of everybody coming into the island, no matter from which port, whether air or sea. And I'd like to report that since tracking, we have reported and registered 90 new vessels in the St. Thomas St. John district. That's 90. And we have an additional 12 in St. Croix. 35 vessels, extra vessels, have left the territory via cargo transport, and more are scheduled to leave by next week. Each one of these vessels are paying more in fees, and we are tracking the GPS coordinates. We understand the anxiety of the public, but I assure you that everything we have done in our response to this pandemic has been based on the facts and the science. I want to make a point to underscore that none of the positive cases in the territory have traced back to any people coming from our seaports. They've either been community transmission, traveling through our airports, or otherwise came in contact with people who had traveled to our airports. Ironically enough, just yesterday we received an email from one of our marine visitors asking us really to ask Puerto Rico or Tortola to allow them to go back into port so that they could leave our waters, because they're trying their best to stay isolated. They don't want to come to land. They don't want to interact with people at all. We received correspondence from the Puerto Rican government on Monday advising us that we should tell all of our boaters not to travel to Puerto Rico. We are in the process of answering that letter, but we don't control the boaters in the Virgin Islands and have no control of where they go. All we can assure is that we're giving them the information that we talked about earlier this week, allowing them to register as moored boaters in the Virgin Islands and allowing us to keep track of them. We also have been able to use the VHF system, the marine system, by radio to let these boaters know that while they're here in the Virgin Islands, what we expect them to comply with. That's the 14-day quarantine, of course, and to let them know that we have a state of emergency and a stay-at-home order in place for everyone, which includes them. Our task force continues to go out there and track the boats. They have even been able to track the boats with a GPS system so that we know what boats are moored and where and when they came. This way we can tell when additional boats are added to the harbor by overlaying the template. Many of you have seemed to be a little confused and have called and texted with your concerns about worship during Holy Week. We encourage the churches to continue to use technology to broadcast and to keep in contact with their parishioners, and those who have to go to the synagogues, the same thing. But note that the social distancing that we put in place, we would just like you to comply with that. We don't want anybody congregating at any of these houses of worship, nor anywhere else on the island during this time of the pandemic. I also want to remind the public, because I'm getting a little pushback by some of our business owners and the like about the police and what the police are able to enforce. I want to remind people that there's a state of emergency in place. So let me be clear. Any order in the state of emergency that is declared by the governor of the Virgin Islands is enforceable by any peace officer. So that means that a police officer can shut down your business, can force you to lock down your gas pumps or your grocery store if you are not complying with the distancing guidelines or the mass gathering guidelines. For the most part, most people are complying with this measure, but we always have a few bad apples in the bunch that don't want to comply. This is a very unpredictable time, and in order to add some predictability in these uncertain times, we have decided that people need to know what's going to go on for the rest of the year. And after much deliberation, we have decided to close all school campuses for the balance of the school year. This does not mean that education will be discontinued for our students. All it means is that they will not be returning to physical campuses for the balance of the school year. And we're doing everything to make sure that each one of our students can report to technical and electronic campuses as soon as possible. The Commissioner of Education, Racquel Benjamin, will be on a little later to tell you all about how we're going to graduate people, what's going to take place, and how do we get our students connected via web to what we have planned for them and all the tools that we have there. I want to close today, as I normally do, at the end of these updates, with asking people to just stay at home. It's a very simple thing to do. Easy thing for you to do, especially during this holiday season. As I mentioned before, we're going into what could be, has been predicted to be our peak. And we want to make sure that we do everything right as we go through this period. This is why we have taken the extra precaution of closing our beaches, not because we don't want you in the water, not because we don't want you swimming, but because we want to keep people from congregating at every single point we can. I know you're going to be tempted to congregate. It's a long weekend. You have cabin fever. You've been locked up for a long time. But please continue to adhere to the mandates of the state of emergency, the stay-at-home order, and resist the urge to venture out and to start to socialize within this time. As usual, protect yourself, your loved ones, and most of all, your community as we go through this. God bless you, and I'll be around to answer some questions as we go on. Right now, we're going to have a word from our Commissioner of Health, Ms. Kimberley Gomez.
It's upside down.
Sorry, Commissioner of Human Services, Kimberley Gomez. Thank you. Here we go.
Thank you. A pleasant good afternoon to all. I'm Kimberley Causey-Gomez, Commissioner of the Virgin Islands Department of Human Services. The Department of Human Services is working around the clock with our federal partners at this time to ensure that we all have access to provisions that will help all Virgin Islands residents during this crisis. Our staff are implementing changes in record time and working to ensure that we can keep up with our new surge and need of critical demand areas like cash, food, childcare, and energy assistance. We exist to advocate for our vulnerable populations and ensure that all Virgin Islanders have access to much needed resources during this time. Like our health, hospital, and emergency responder colleagues, our human services employees are always on the front lines every day and serve our Virgin Islands community as essential employees in this time, national uncertainty and hardship. The Department of Human Services acts as a safety net, providing a wide range of critical social services to members of our community. The Medicaid program is a government-sponsored program that aids with health care coverage to people with low income. This joint program, funded by the federal government and administered at the state and territory level, varies. Patients receive assistance paying for things like doctor's visits, our long-term medical, custodial care costs, hospital stays, and more. The Medicaid program is currently offering the following member benefit flexibilities. We're automatically extending all Medicaid Children's Health Insurance Program, otherwise known as CHIP, recertifications for 6 months. This will enable us to ease the workload on our eligibility workers and enable us to support social distancing. We're going to eliminate the current requirements for member to obtain a service referral from a public provider and prior authorization, except for certain dental and durable medical equipment from the Department of Human Services prior to obtaining services from a private provider. This will enable all our members to receive services from any enrolled Medicaid provider without any referral or prior authorization. We will also extend presumptive eligibility already being performed in several of our hospitals and our federally qualified health centers and the Department of Health clinics to pregnant women, the aged, blind, and disabled populations. We're also going to extend the eligibility period for all presumptive eligibility applications for 90 days from the date of the application to support the social distancing while providing continuous eligibility for needed services. Presumptive eligibility provides Medicaid for a limited time while formal Medicaid eligibility determination is being made by the Virgin Islands Department of Human Services. The goal of presumptive eligibility process is to offer immediate health care coverage to people likely to be Medicaid eligible before there has been a full Medicaid determination. For our Medicaid providers, the following flexibilities are important, and the Department of Human Services Medicaid program will postpone deadlines for revalidation of all provider agreements for the duration of the COVID-19 public health emergency. This is applicable to all providers currently enrolled with the Medicaid assistance program, including off-island providers. We'll also waive normal provider screening and enroll activities in those cases where a provider is already participating in a Medicare provider or a participating Medicaid provider in another state or territory. We'll reimburse for hospital and other services rendered in an unlicensed facility, we will assess to reasonably meet minimum standards and expectations, including health and safety and comfort for members and staff, consistent with the current COVID-19 public health emergency for Medicaid members placed there during an emergency evacuation or due to the need to relocate Medicaid members from the placing facility while the placing facility continues to provide services. This would apply in the event our hospitals became overwhelmed with patients. We'll provide clinically appropriate care using telehealth technology, primarily through our Department of Health clinics, our federally qualified health centers, and our physicians, and payments will be made in the same manner as the services was furnished to a face-to-face setting. We continue to work with our federal partners, Centers for the Medicaid and Medicare Services, CMS, to ensure that all available flexibilities and authorities are implemented to allow us to provide quality healthcare services to our citizens of the United States Virgin Islands. For more information, please contact our office on St. Croix at 340-772-7117, 772-7100, or 774-0930, extension 308. Our Head Start program will continue with food distribution. However, in honor of the Easter holiday, we will not provide food distribution Thursday, Friday, or Monday. The classrooms continue to be closed until further notice, and if you have further questions, please visit our website. Our Office of Child Care and Regulatory Services will only process block grant applications, child care subsidy applications for informal child care providers known as family, friends, and neighbor care. For additional services, please visit our website at www.dhs.gov.vi to learn more about our 80-plus programs that can provide temporary assistance when it's most needed. I'd like to publicly thank each one of our Department of Human Services team for the dedication and commitment they have shown during this time, and that they know and we know that together we can make a difference. Thank you.
Now we'll hear from our Education Commissioner, Commissioner Racquel Berry Benjamin.
Virgin Islands Department of Education family. I'd like to take a moment to honor the memories of two beautiful lives we've recently lost. Mr. Kijani Connell, an 11th grade student at the St. Croix Educational Complex High School, and Ms. Alana Liebert, a paraprofessional at the Lockhart Elementary School, and daughter of former Senator Armando Rocky Liebert. Like natural disasters, the coronavirus pandemic has created fear, anxiety, and added stress to students and families. To ensure services are in place to meet the mental health needs of our students, the VIDE has partnered with the VI Department of Health, Department of Human Services, Insight Psychological, Women's Coalition, Island Therapy, and Beautiful Dreamers, a nonprofit organization that provides educational programs and mental health counseling and coaching to families. Beautiful Dreamers has begun a series of trainings for our school counselors on the 5 major classifications of mental health and their symptoms: anxiety disorder, mood disorder, schizophrenia and psychotic disorder, dementia, and eating disorder. Additionally, training focused on knowing when to refer a child to a clinical therapist, knowing the difference between compassion and empathy, and providing school counselors with the skills necessary to assist in the pandemic and to provide clinical counseling to students. Guidance on how families can utilize mental health services will be put in place by the Department of Education, will be published as soon as details are finalized this week. As Governor Bryan previously mentioned, for the remainder of the 2019-2020 school year, students and school staff will not be returning to the physical school buildings. The ongoing response from the department during the closure of schools due to COVID-19 is to ensure education continues for students while they are at home. The third marking period ended on Friday, March 20th, 2020. Students are required to take a photo of the completed assignments from the work packets they received upon the closure of schools on March 17th and email those photos to their teachers. Teachers will indicate to parents and students which assignments to submit. Submission deadline is Friday, April 24th, 2020. It is important to note that a standard practice in the Department of Education is for teachers to remain in regular contact with students and parents. And this practice continues. In an effort to ensure learning is continuous for all students, in the absence of technology in some homes, the department administered a home technology use survey to gauge students' access technology and technological devices at home. To address the issue of all students not having access to technology at home, the VIDE leveraged currently available federal funds and reprogrammed those monies to secure internet access and other technologies for students. Additionally, each school district will be providing students who indicated they did not have any technology at home, such as a laptop and or a Chromebook. By expanding existing online educational platforms, such as Edmentum, Acellus, and iReady, students will be able to continue learning at home. Senior high school students in the St. Croix district uses Acellus to help with credit recovery. The equivalent to Acellus in the St. Thomas St. John School District is Edmentum, formerly known as Plato. First through 8th graders will use iReady to continue their learning. Additionally, individual teachers use apps they deem as beneficial to their students, parents, and their work. Examples of those apps are Class Dojo, Edmodo, and the Remind app. As an added measure, the department partnered with community stakeholders to launch the e-Teacher Network, which is another avenue to provide students educational offerings through television, radio, and social media, specifically Facebook. As it relates to student promotion, the promotion and retention of students are determined by policy set by the Virgin Islands Board of Education. The VIDE and the Board of Education recently met to discuss important matters around the impact of COVID-19 on students, schools, and teaching and learning. The board has provided the VIDE a draft resolution it created to address the promotion and retention of students during COVID-19 emergency. The VIDE will take the necessary actions to comply with the board's policy, which will apply to all students in the Virgin Islands public school system, and will be sure to communicate next steps with parents. Discussions on matters such as the selection of the valedictorian, salutatorian, top 10 students, honors, credits, and GPA for senior high school students, among other things, will be made after hearing the board's decision on the policy. The VIDE has also taken proactive steps to determine important subgroups among high school students who we can provide necessary support. While there will be no physical graduations, the Department of Education has determined that virtual graduation ceremonies are the best path forward to celebrate the achievements of the class of 2020. Summer enrichment will also be offered to students in a safe and effective format. Before students, faculty, and staff return to the school buildings, schools will be sanitized according to the guidance and recommendations provided by national and local health officials. Thank you, school administrators, teachers, nurses, parents, and students for remaining strong during this process. Looking to the future, the VIDE has begun planning for a permanent distance learning infrastructure to be embedded in our teaching and learning. We have created a cost proposal for a distance learning infrastructure upwards of $14.5 million. This cost is an estimate based on the department's current student and employee population, the current cost of internet, computers, and laptops, courses, interventions, and assessments and support, as well as the training for IT staff, principals, teachers, students, and parents. We trust that the 2020 CARES Act will assist in the VIDE's efforts to transform public education in the Virgin Islands as we know it. We are presently reviewing the details of this act to capitalize on what it allows us to do. Thank you.
Thank you, Commissioner. I just want to say a special, I could say condolences to all those seniors this year that are not going to be able to go to prom, that are not going to be able to go to graduation, all the class trips that have been canceled. It certainly is a very sad time in our history. My daughter, too, is graduating this year, and, my heart goes out to all of you, as your senior year is something so memorable that you always will hold dear. But if this year will be specifically traumatic in your memory in terms of what happens, but these are the decisions we have to make in order to keep people safe and to make sure that you get to go to college or off to trade school or off to the armed services after graduation. So thank you, Commissioner, for sharing that with us. All of these decisions are really tough decisions on our part, but we've been going really good. I think that we're off to a good clip. We want to keep it that way. And remember, and I said this last night, I was on the radio last night on WSDA. Even if we never have a case of COVID again for the next month, as long as there are cases in Miami, New York, North Carolina, Atlanta, places that feed into here, we're going to have to stay under the same restrictions. So it's not how good we do alone. It's how good the world does in dealing with this situation. We're just a small place. And, we are very fortunate. I don't think people realize that at least we can go out into our harbor and track the boats. We can track the 20, 30 people coming into each airport every day. But remember, in the United States, they have a freeway, a state, interstate, that connects them to every single city in the world. And it acts as like a vein or an aorta of just pure COVID being pumped into communities. And even if you look at the map, you could see how that is spreading throughout the nation. So we are very fortunate in terms of being able to monitor our patients every single day, calling them, to be able to see who's coming into our airports, and to be able to manage the activity in our seaports as well. So I'll open up the mic, the phone. Remember, listen to your phone, not to Facebook, and for any questions that you may have as we move forward. Go ahead.
Good afternoon. This is AJ Rapp with the Daily News.
Hey, AJ.
Hey, sir. I had a question for the Education Commissioner. Do we know how many students indicated on their survey that they don't have access to online services or technology at home? And do we know when these students can expect to receive the necessary resources to do that type of work?
Hi, thank you so much for the question. So territory-wide, and we have this data by district as well, territory-wide, 47% of our students indicated that they do not have a desktop computer at home. 69% said they do have laptops at home. 66% said they have a handheld computer or smartphone. 34% said they did not. And 18% of those students surveyed said they did not have internet access at home. And we worked with we programmed our federal funds in order to secure Wi-Fi and internet connection from our local providers. And based on the discussions that we've been having so far, it looks like we're going to be able to provide these devices to our students within the next week or 2 weeks maximum.
And does the Education Department have a plan as far as students who may not know how to use the technology or may not be familiar with the apps? Is there a plan for that?
Yeah, so our students and teachers have been communicating via telephone, via Teams, via Zoom, and many other platforms that they've been using throughout the school year. So any training that needs to be done, the teachers are the direct point of contact to our students and parents, and they are the ones who tell us, this is what this family needs, this is what this family needs. And when we distribute these devices to our families, anyone that is in need, the IT department will connect to the families through the various technologies that we're using now, whatever it may be, whatever the family has and is most comfortable with.
And I just have one final question for the governor. Just in regard to the closing of the beaches that was announced earlier this week, just wanted to clarify, is there any exceptions to that closure. For instance, individuals who swim at the beach for exercise, they may not be congregating, but they're just exercising in the water. And also boaters who have dinghies who want to come to the shore for groceries and supplies. Are there any exceptions at all to the closure?
The beach is not closed to boaters coming to shore in order to get supplies. I think we have to have a common sense approach to this. The beach is absolutely closed to anybody swimming by yourself or with 10 people. The beach is closed. This doesn't have any impact on people who are commercial fishermen, people who have to go to their boats or live on their boats. It's not closed for that. We're really referring to swimming beaches that are closed.
All right, thank you.
Next question.
Good afternoon, Governor. This is Sue Burke with TV2. This question is for the Commissioner of Education. We wanted to find out, being that the number of students who do not have access to technology based on the data that was just provided is so high, how is it that they're going to be meeting the deadline of submission of paperwork to the teachers, and then, that information is going to be inputted and then spit out in the computer to be able to advise parents of grades? If the infrastructure isn't currently available to do that, how are students are supposed to be able to take pictures and submit their work? Because the data is indicating right now, based on what was reported, that the majority of students don't have access to that. That's my question at this moment, Governor.
Thank you for the question. So our students, and let me repeat those numbers before I answer your question. Territory-wide, 3% of students, they do not have internet connection.
Right.
That's through a desktop computer. 47 have a desktop computer. 41% territory-wide do not have a laptop. 59% have a laptop. A handheld device or smartphone, 34% do not. 56% have a handheld device or smartphone. 18% do not have internet, and 82% have internet. The question around submitting assignments, we were very sensitive to that at the Department of Education, and what we decided was the work was due on the 14th when we returned from Easter break. We've extended it out 2 weeks, and it's only the contingency plans, the emergency plans, those topics that went home, specific assignments that teachers want. Students and parents have 2 weeks to get pictures, whether they're using their personal cell phone, maybe they're using their neighbor's tablet, a parent. We're giving them an opportunity to use some form of electronic device, even if it's shared for now, because we need to get and limit the physical contact between our students for protection as well as our staff. So we're lenient in, it's not due now, take your time, you have 2 weeks to get it in. What was the second part of the question?
I want to thank you so much.
Thank
you so much, Commissioner, for all that you're doing. We understand that the job is tough, but you built for it. And I know that our children would not be left behind. Also, we noticed that there's some changes now for the Easter holiday in reference to the initiative. And thank you for spearheading that initiative. Virgin Islands children will not go hungry, especially during this time of crisis. But we wanted to correct the information with you that there will be no food distribution from when, effective when? On Thursday or Friday?
Right. So today is the last day for the week for meal distribution.
Okay.
And as you know, government offices are closed over holidays, and that's the reason why meals will not be served. Our employees will be on holiday as well. So our meals,
and then they resume
the last day, and they resume April 14th, which is Tuesday. So our families will receive breakfast and lunch again on Tuesday.
Thank you so much, Commissioner, for being proactive. And I know that during these time of crisis, you're definitely one that comes up with solutions. So we want to take the opportunity on behalf of TV2 News to say thank you for all the efforts that you're putting forth for the students of the Virgin Islands.
Ms. Burke.
Next question.
Yes, good afternoon, Governor and Commissioners. Robert Moore with the VI Consortium here.
Hi, Robert.
Mr. Governor, my questions are a couple of brief questions surrounding testing capacity, COVID testing capacity, and the testing protocols. So based on the very detailed and timely data that was released this week by the Department of Health, it appears that there's been a large fluctuation in the number of test results that are pending. And I'm wondering if that is sort of a function of an increased capacity for testing in recent days. Can you give us some sense of on average, how many tests or what is
The Health Commission.
Tests that are conducted daily?
The Health Commissioner is here, Robert.
Good afternoon, everyone. We actually are still running our hotline, and we receive about maybe 47, 50, sometimes over 60 calls per day. And that allows us to figure out whether or not they meet the criteria for testing. And so those numbers actually vary depending on the number of calls, the number of inquiries that we actually receive. So we do still have the capability of conducting 30 tests per day within our public health lab, and we can we have at least 450 swab and media viral kits so that we can run those samples if need be. So we've been pretty consistent in what we were able to do. Did I answer your question?
Thank you. And, yes, it does. Thank you. And based on that data, it appears, if I'm reading this correctly, that sort of the largest segment of our population that is being tested are the 18 to 49-year-olds. That data also suggests that the smallest population that's being tested are those 65 years old and older. And those, if I understand correctly, are the most vulnerable members of the population. Why is that testing sample so small comparatively?
I would like to think it's because the older ones are staying at home and they're following the rules. The younger ones are going about a little bit more. They're becoming a little bit more exposed to the individuals around them, the ones that are traveling within the territory and then becoming infected for that reason. And so we actually had the discussion this morning. Dr. Morrow, who is the acting CEO of Royal Liston Sinai Hospital, indicated that worldwide, actually, they've actually seen that age group as being the ones more showing positive signs. And so we in the island, we're seeing the same trend, but we contributed to the fact that they move about a little bit more.
I'd like to let you know, Robert, too, and the public that Dr. Ellis is on tonight on the tomorrow on the virtual town hall at 5:30. I won't be there. She will be there, and she'll be going through those numbers. And you can ask the expert any questions that you may have.
If I may,
I will do.
the situation rep that you're actually seeing on a daily basis, we're trying to put that out every evening between 6 and 7 p.m. That situation rep was drafted by Dr. Esther Ellis and her staff, and that actually comes with a lot of full details. And if you read that rep, when you speak with her tomorrow, you'll probably be able to come up with a lot of different questions as well.
Very good, thank you. One final question for you, Mr. Governor, and very briefly. Under the state of emergency, there is a moratorium on the home evictions for renters. Is there any discussion going on with the local banks regarding any forbearance or ease of matters for mortgage holders and mortgage payments to local banks?
Absolutely, Robert. The CARES Act that was passed by Congress recently actually guarantees the forbearance part for those people who have federally backed mortgages. Automatically, you can go into your banks and get forbearance. The banking board, who is still active, will be making a statement later this week along those lines, and the banks are also going to be reaching out and allowing people to do that. The CARES Act also guarantees that if you get that forbearance, that you can't evict your tenant, so it's a double coverage there. We're doing it as well as the federal government. I just want to remind people along that line, though, remember, it stops your tenant, your landlord from evicting you, but it doesn't stop them from starting the process of eviction. So please pay your rent if you can afford to. Other questions?
Hello, good afternoon, Governor Bryan. This is Ali Bonzanak with USCI News.
Hey, Ali, how you doing?
I'm doing well, thank you. My question is for the Commissioner of Health. Is there an update on the tests? I believe you had mentioned last week the Virgin Islands getting a test that would allow us to have results within 24 hours. Is there an update on that?
We're trying different venues to be able to get that test as soon as possible. We actually, right now, we're looking at private entities to try and get that test. FEMA and the Department of HHS is also assisting with us. As you know, right now those tests are being shifted towards New York, New Jersey, all the other states that have so many higher numbers than we do at this point in time. But we're keeping our fingers crossed, and we're hoping to get it within the next week or two.
So how long is it taking us on average to produce a test, Commissioner?
About 4 hours.
Yeah, so she asked in 24 hours. I think you were talking about the 45-minute test.
I was speaking about the 45-minute test. So we actually run a test right now, maybe 4 to 5 hours, depending on the number of tests we're running at the same time. So that's what we can do right now. There are two more tests. One, actually, you can run a quick test you can run within 5 minutes. We've actually ordered those as well. We've ordered those for the hospitals because we have 3 machines, one at each hospital and one at public health, that can run that test. And then there's another test within 45 minutes. We're waiting for that to come as well.
Fantastic. So we're doing our best to help those people that are on our front lines. We got another shipment of personal protection equipment yesterday, and we continue to amass those supplies and get them in as quickly as possible, because we want to make sure now that all our vulnerable points at the hospitals, the airports, any other ports, and our first responders are covered as much as we can as we combat this pandemic. Other questions? Go ahead.
Hello, good afternoon, Governor, everyone. This is Lasiba Knight over at the St. Francis. I was hoping to find out exactly how large are these shipments that we're getting in from the national stockpile, if this last shipment is from the national stockpile. And then I also wanted to ask you, Governor, if you believe that the boats that are docking off of St. Thomas, the pleasure vessels that now that the season's over, they have nowhere to go, if you view those as a greater threat of a spreading COVID-19 than incoming arrivals from the airport. I saw the other day that we believe there's going to be about 500 of those ships coming to the territory. Each one of them has a crew of at least 2 to 3 people, some of the bigger ones even more. So I'm just wondering if you think that might be a bigger threat for the spread of COVID-19.
Yeah, I think our biggest threat is definitely the airport. That's our pressure point. I mean, that's not even a guess. That's a documented fact. When I monitor the Caribbean, especially as to where the COVID virus is really exploding, and right now it's north of us. It's the Dominican Republic as well as Puerto Rico have the highest recorded cases. East of us, we don't have as much of a threat that way. So, but I'll let the Commissioner answer the other part of the question.
Okay. So right now we actually received 3 push packets, and push packets, basically what it means is that we didn't request those. Those are what they had there, and they divided them within region 2, sorry. That's where we are. And so we're getting a little bit, it's minimal, but what we've done is that we have a distribution plan that's developed by Department of Health and also managed by VITEMA, And we are expecting, so we got the third yesterday. That's going to be shifted to St. Thomas as well. And we are now expecting a larger shipment that's coming in. That's the one we actually requested. So far we're getting hundreds. We're expecting thousands. That will be the difference.
Other questions? Go ahead.
Good afternoon. Sean Pennington from The Source. You guys are doing a terrific job, by the way.
Thank you, Sean.
The question I have is relative to statistics, and it's something that's come up regarding the one death we've had compared to the testing and the number of reported cases. My question is, when doing these comparisons, which it leaves us with the average that everybody else is experiencing of about 1 to 2%. But what we haven't considered, or nobody that I've seen has considered, is how many cruise ship passengers and other visitors we had while this virus was moving around without us knowing it. Has anyone considered that relative to really how well we're doing? Not to have people running out in the street congregating, but
one of the things, Sean, that I really love the numbers. I mean, I manipulate them a lot. Those are worldwide, those nationally, and locally as well. And one of the dangers in doing it locally is that there's such a small sample size that minor changes create huge aberrations in your count. So you have to be careful when you're doing it from the sample size. I'd like to remind the public, though, that when you look at our testing compared to other places' testing, that we started locking down our ports, our movement, our schools. We had a state of emergency way before anybody else did. There were only like 3 or 4 states that were ahead of us. And we followed the good example of Gavin Newsom in California. He sort of gave the first clarion call about this virus and where it was headed. So we did that immediately. The people that we're testing in the Virgin Islands are the most likely to be infected. I think the early restrictions to movement has helped us a lot. As a commissioner rightly noted, that 18 to 49 group are the people who are going to be moving around the most. And all the reports that we're seeing now are saying those people are most likely the carriers. So those are the people that take it home and bring it to places. The other thing that we have seen too is families creates exponential growth. So if you, one person, carry it home, your wife and your 3 kids get it. So that makes the numbers jump as well. But if you're not going anywhere to get it, then you can't get it. If you're at home in your house by yourself and you're not letting anybody in there, you can't get it. It's not going to come knocking on your door. So you need to stay at home. Was that our last question? We have one more question.
Hello, good afternoon, Governor and the Kimberley Consortium. A question on the territory's finances since the pandemic. Also, can you get an update on when local residents will get the stimulus monies from the CARES Act? So I know each family or each person would get $1,200 or so. But I also wanted an update on the territory's finances, and so what is payroll for government employees looking like, and how long can we sustain? What about have we been able to secure the monies through the legislation that was passed, allowing the government to borrow about $120 million? An update on that would be good, please. Thanks.
So in terms of the government finances, we are about 9 days cash. One of the things that we didn't take into account was, we stopped getting as much revenue, but we also stopped spending. Everybody's at home, so we're not spending money at the clip that we used to before. We are expecting a term sheet from the banks this week, and then we should be looking at that to see if we can agree to the terms, and then we could look for the cash. We figure we're going to be in trouble in another 2 or 3 weeks worst case scenario, and another month or so, month and a half, best case scenario. So we continue to appreciate all of the people that are paying their taxes early, paying WAPA, trying to keep our government afloat. Brisa Max for all they're doing, putting that ad in the paper, asking the major taxpayers to pay now and to pay the advance. We appreciate that. We're trying our best to get out as much payments in terms of the payments that are due for the roofing contractors, the payments on projects, just to generate activity in our economy. As we stated before, Treasury's their date is April 24th. We're trying to hit a due date of maybe a week or two after that to get those checks out as quickly as possible. All indications are most of the nation is going to be on lockdown then. We're going to measure it because we don't want 40,000 people or so going to the bank at one time because they will be paper checks. As I mentioned before, too, we have a cross analysis with Social Security who will be issuing checks for some of those people who are collecting Social Security and not filing taxes. So you'll get it that way too. But as we have figured out a way to get the money and to get it to you. But as we get more information from Treasury, I'll bring the IRB Commissioner Director up here for you to share. Before we go, I just want to say that this is new for all of us. This is not new for the Virgin Islands. It's new for the world. All of the things that we're doing have never been done before. The things that we're putting into place is doing the best we can do given the resources and the circumstances of our situation. The information that we give to you on our decisions is after long hours of deliberation and a lot of hard work by experts, not us guessing, by people at the CDC and people like the commissioners and Dr. Ellis and that you see. People in your community that are making these decisions, not because we don't want to have people on the beaches or ruin your Easter vacation or be discriminatory for those people who live on the boats versus us who live in the Virgin Islands and the land. We're doing this because we want to keep people safe. I want to say a special thank you and appreciation to all the teachers out there that are doing their best to manage with the students. It must be incredibly difficult to keep track of all those students and give them lessons when we under this time. You always have the resources that are in the schools. The schools don't have any COVID in them. So you can make contact with your principal, teachers I'm speaking to now, in order to make arrangements to go in. If you need access to the internet, to resources you have in your classroom, we're just trying to make this transition period as easy as possible. We know there are difficult times. We know there is uncertainty in the community. But as we go into this Holy Week, let's just thank God for all the blessings that we have in the Virgin Islands, that so far we haven't seen an influx of patients to our hospital, that we aren't running out of ventilators, that people are not dying in the aisles of our hospital or being loaded into trailers. Let's be grateful for the things that we have, that every single day in this Virgin Islands, the sun comes up and we can connect and we have each other. We might be seeing one another digitally now, but there'll come a time again when all of us can be able to play Mass and make this Virgin Islands the great place we know it is. God bless you. I love you and have a fantastic Easter weekend. The Spanish version of this is coming up next, so you can stay tuned to that. Thank you.
Buenos días, Virgen Isleños. Espero que se encuentren bien y se mantengan seguros y desinfectados. Hoy me acompañaron la comisionada de Educación, Racquel Benjamin, y la comisionada de Servicios Humanos, Kimberley Causey-Gomez. Hasta la fecha, 322 individuos en el territorio han realizado pruebas para COVID-19. 242 de esas pruebas dieron negativo, 45 positivos y tenemos 35 pendientes. 39 de los 45 se han recuperado, lo que significa que estamos rastreando a 5 individuos con el COVID-19 en el territorio. Esto nos deja con 5 casos activos. Actualmente tenemos un paciente positivo con el virus hospitalizado en el Hospital Juan Francisco Luis. Nos complace informar que 2 de los 3 pacientes con COVID-19 hospitalizados en el Centro Médico Regional Roy Lester Snyder se están recuperando y serán dados de alta hoy. Los animo a todos a visitar la red del Departamento de Salud, donde se desglosa información por isla y por datos demográficos seleccionados. Este sitio en la red es doh.vi.gov y el informe se actualiza diariamente por la noche. Se ha discutido mucho sobre los barcos en nuestros puertos. Al principio de nuestra respuesta a esta pandemia, creamos un grupo de trabajo marítimo y han estado siguiendo esta actividad con mucho cuidado. Informo que hemos registrado 90 nuevos buques en el distrito de San Tomás y St. John y otros 12 en el distrito de Santa Cruz. 35 buques han salido del territorio a través del transporte de carga y más están programados a salir la semana entrante. Cada una de estas naves paga cuotas de amarre y estamos rastreando sus coordenadas por medio del sistema de posicionamiento global GPS. Entendemos la ansiedad del público, pero les aseguro que todo lo que hemos hecho en nuestra respuesta a esta pandemia se ha basado en hechos y ciencia. Quiero hacer una observación para subrayar que ninguno de los casos positivos en el territorio ha sido rastreado a personas que entran por nuestros puertos marítimos. Muchos de ustedes han escrito y han llamado con sus preocupaciones acerca de la adoración y cultos durante la semana entrante, la Semana Santa. Alentamos a las iglesias a seguir transmitiendo sus servicios de adoración a través de la Internet, pero deben observar las guías de distanciamiento social y físico y las reuniones de más de 10 personas todavía están prohibidas. Los devotos no pueden congregarse en las casas de culto o adoración. Deseo recordarles al público que estamos bajo un estado de emergencia y una orden de estancia en casa. Permítanme por ser claro, todos los oficiales que ejercen el cumplimiento de la ley durante este estado de emergencia están autorizados para cumplir los mandatos de la orden ejecutiva. En estos tiempos de incertidumbre y con el fin de añadir cierta claridad, hemos decidido cerrar todas las escuelas para